women have a different way of presenting with heart attack symptoms or heart disease symptoms compared to men. Most of the literature is full with symptoms of men having heart disease, and symptoms are very much written in line with what men would experience. But women tend to experience and present with heart disease differently than men. Symptoms are not very clearly the typical symptom that we hear. The chest is really tight and the pain goes down to left arm. That symptom is obviously common, but is not the only absolute way for heart disease to present. When people are having heart disease, they have two levels of symptoms. One is a stable angina, where they're having some discomfort with activity, but whenever they cease that activity, the symptoms go away. So that is a stable phase of disease. That means there is a blockage which is restricting the blood flow to the heart, but once you reduce demands on your heart, the blood flow goes back to normal and you start going back to normal without symptoms. From there, there's a progression of symptoms to the point where you start having symptoms with no activity, or symptoms are becoming more frequent with less activity. That is the unstable phase of the disease that tells us the heart disease or the heart artery blockage is getting significantly worse, and you're very close to having a heart attack if this is not corrected. But symptoms still will be relieved after some time. But once the symptoms start, and by symptoms we mean pain or tightness in your chest, or symptom of feeling uneasiness with associated significant sweating, or feeling of palpitation in your heart with sweating and some discomfort going down to your arm. And the whole area of discomfort could be anywhere from your belly button all the way up to chin. So it's not really limited to the anatomic word chest. It could be a whole area of front of the side, left side of your body, going up into your left or right arm. And when these symptoms start lasting for more than 5-10 minutes in duration, you're in unstable range. But once you're more than 30 minutes with these symptoms, then you're definitely having a heart attack. That is the time when you do not want to wait and call 911, because no amount of driving fast or going to your doctor's office will help you. One thing which women need to understand is with every heart attack, there's a 50% risk of dying within few minutes, which is a very well-established fact, but not very well-known fact. So that's why sooner somebody gets to you with a nitroglycerin, aspirin, and sooner somebody takes you to a hospital where they can help you with your heart attack, the best it is for your overall longevity and the quality of life later on, how much damage you're going to endure from the heart attack. And in cardiology, we have a term that time is muscle when it comes to heart attack. So more time you spend at home pondering over your symptoms, more muscle you're losing. That means your heart is getting weaker by the minute. So if you get symptoms of any pressure, heaviness, tightness in your chest with significant sweating, shortness of breath, or associated nausea, and symptoms have lasted for more than 5-10 minutes, and they're not getting better, you need to call 911 and seek immediate medical attention.